commercial sex worker together with my friends here. The need to work with Brothers of St. Joseph is due to the various problems and challenges we are facing and some of our colleagues continue to face in the course of our occupation. We joined hands and formed this group to enable us discuss and look for solutions to our problems. Our work, of course, is very risky and sometimes traumatizing. For instance, some of our clients fail to pay for services provided, and most end up becoming very violent when asked to pay. Most of us have been abused physically, ending up without money and serious injuries to us. The group sought assistance from Brothers of St. Joseph and joined together to work with the group. We have since undergone a major transformation in the way we approach our work in the last 10 years. Life here in the village has been a roller coaster of many challenges and problems. But for the last 10 years, we have indeed seen light. Some of us have gotten married and left the village, and others have quit and started income-generating projects. We look forward for a brighter future in the next 5 years and the future. Our children rarely go to school, and this is not because we do not want to. We have many children here, and in any case, like my friend here who is already having 4 children and now pregnant, may be wondering what to do with such children. We deal with clients who are never concerned about our health or status, and majority are only interested with pleasure, and we are left to fight squalor, poverty, and sometimes many diseases. This has always been an issue for us here in Kiawara, but we are happy that after joining in the group, we are able to resolve some of the problems. Lois Nyagodie is another member of this community. She is all praises for the wonderful work that has been done by the program. She says that her children has been assisted in many ways. More so, she has been able to attend medical care within the dispensary run by the Brothers of St. Joseph. The children are also given nutritive foods, and she has also attended vocational training, and now she is a qualified salonist. She looks forward for further assistance from this program and is willing and committed to work towards her own health, that of her children, and that of her community.
Wakati ule Yesu akajibu akasema, nimshukuru Baba Mwana wa mbingu na nchi kwa kuwa mambo haya.
Moireri village is on the eastern side of the district. Here, the project works with 5 community groups, one of which is St. Catherine. Moireri village is semi-arid, and many farmers depend on very simple subsistence farming. We visited this group comprised of 11 members, most of which are infected and affected. One of them is Veronica Nduta, a mother of 4 and positively living with HIV. Her story is that one of courage and determination. She says that she got tested in 2002 and was found to be HIV positive. She further says that it was very difficult to accept her status, but later, when she joined initially the St. Joseph group, she was cancelled and accepted her HIV status. She has since worked along with a group initially comprising of 10 members, some of them now who have left us. Today, she says that she is a proud member of St. Catherine Group and living positively with the virus. Through assistance from St. Joseph HIV and AIDS Self-Help Group, she has been very healthy and working towards supporting her 4 children. She has 1 dairy goat that provides her family with 4 liters of milk every day. She also has a dairy cow, and she is very proud to be a member of the group. She is on ARVs, which she gets from the Brothers of St. Joseph Dispensary in Muiga. She says that she is fully supported by the community and she has fought stigma very effectively. She urges those not tested to do so. She concludes by saying that testing has made a great difference in her life. Veronica is happily looking into the future with courage. She is able to do all what a mother can do to her children and family thanks to the program. On the other side of Mwireri village is Jengo village. Jengo is the home to St. Paul community, which comprise of 20 members, 10 of whom are living positively with HIV. The group has 20 caregivers and 4 community health workers. We meet Veronica Wanjiro Kamweru. This warm and wonderful lady is not only a member of the group, but she is a trained community health worker. She is living positively with HIV. She says she came to know of the program by the Brothers of St. Joseph when she discovered that she was actually living with HIV. She has greatly benefited from the program's interventions. She has attended many seminars on how to cope with various challenges of living positively with HIV, especially on matters of stigma, treatment, nutrition, and general hygiene. As a trained community health worker, she has supported many members of her community to accept their HIV status and live to the fullest. The group has benefited them so much through the livelihood program interventions. The group keeps rabbits that provide valuable proteins to the infected, dairy goats that provide daily milk, and cows that also provide income for the affected and infected. Rabbit meat, which has high protein value and is very, very important for those who are suffering from the disease. She underscores the assistance given to community, especially the provision of school fees and uniforms to orphans and vulnerable children in the society. Other activities of the group include home visits to people living with HIV and AIDS through the Community Health Work Network and the training offered to caregivers. Other benefits of the program include a VCT and a dispensary that caters for members of the community. She says she has greatly benefited from medical services offered in this dispensary. She urges all those who are not tested to make the urgent decision to know their status. She formally says that the Brothers of St. Joseph has a very friendly and very effective program to work with. Other assistance include support to orphans and vulnerable children, nutritional support through supplementary feeding, and supply of ARVs. She says that she is able to live to the fullest due to accepting her status. She further quoted John chapter 10 verse 10, which says that Jesus says that he came that we may live life to the fullest.
Marina mundu murwaru to nimonaga ona matitikania nie ndi murwaru monaga ndi na hinya mwingi muno rimo kama kanjita niguo thingama teithia andu acio marwarite kure na guku icagi-ini so andu aria othe mari arwaru ni ngiuga mwitikire uguo muri na muge no murimu ta uria ungi na maisha itaendelea.
Amboni village is about 7 kilometers south of Muiga township, very close to the Aberdare ranges. The St. Joseph HIV and AIDS self-help group has been working with communities in this village, supporting many people affected or infected with HIV and AIDS. We stop over and meet Mrs. Josephine Mogore Githaiga. This lady is not only a member of St. Augustine community, but she is the trainer. She has been in this group for the last 10 years. She got involved in the activities of this group after losing her own sister and taking charge of 6 orphans left behind. One of the orphans is indeed HIV positive. Josephine is a member of St. Augustine community. She is a mother of 3 children and got involved in the activities of the program after taking charge of 6 orphans left behind by her sister. She works alongside 6 community health workers, 56 caregivers who all are charged with the responsibility of supporting 69 people living with HIV and an additional 265 orphans and vulnerable children. As a volunteer, she says that she encounters a lot of challenges, one of which is that she has to make home visits to all the 69 people living with HIV, and besides that they are also supposed to work together with the other community health workers in preparing home visit reports and other follow-up activities to the program. She explains that she is involved in the implementation of various interventions under the Brothers of St. Joseph's program. These include the rearing and keeping of dairy goats and dairy cows to some communities. She explains that it is very suitable for the small farmers to keep dairy goats because land is not as big as in other areas. It is very appropriate indeed because they get adequate milk supply for their families. She says that they are grateful for the wonderful services they get from the Brothers of St. Joseph project. They have access to VCT, home-based care, orphans and